By creating awareness and sharing practical guidance, we aim to empower you with the knowledge needed to take timely steps in protecting your eyesight and ensuring long term high health. It's my privilege today to introduce our esteemed speaker, Dr. Pratibha Shukla. Dr. Shukla is a medical retina and retinopathy of prematurity ROP specialist as well as an accomplished cataract surgeon. She holds an MBBS, DOMS, FMR, and FROP and completed a fellowship in medical retina, ROP, and phacoemulsification at the HV Desai Eye Hospital in Pune, where she also served as a consultant in medical retina and cataract services. Her expertise covers the early detection and management of adult retinal disorders, advanced laser procedures, precision cataract surgery, and specialized care for ROP. Beyond her clinical skills, Dr. Shukla is deeply respected for her patient focused approach, ensuring every individual receives thorough evaluation, clear communication, and personalized management. We are honored to have her with us today. Please join me in welcoming Dr. Pratibha Shukla as she shares her insights on diabetic retinopathy and guides us on how to protect our visions for years to come. Over to you, Doctor.
Thank you so much, Madam Ashwini. It's a privilege for me to be here associated with you, Vayah Vikas, who are doing such a great job for all the senior citizens of our country. So today I'll be talking on the basic eye care and a very important cause of leading blindness, which is diabetic retinopathy. So as we get older, a few conditions can become very common. Uh, like after the age of 40, everyone is going to get a reading number. We call it presbyopia in our medical term. After a certain age, everyone is going to get a cataract also. Then there can also be glaucoma, age related macular degeneration, dry eyes, and in patients with diabetes or high blood pressure, especially when the diabetes and blood pressure are not under control, there can be problems like retinopathy. So, I'll mainly be talking about diabetic retinopathy. Yes. So to start with, diabetes is a major concern in everyone these days, and it is a silent disease which is affecting millions. Silent because in the earlier few stages, patients can have absolutely no complaints. What is diabetic retinopathy? Diabetic retinopathy is basically damage to the retina, which is the light sensitive layer at the back of the eye. Retina is the layer where vision is formed. So, because of uncontrolled diabetes, there can be damage to this layer of the eyeball, and it can also lead to vision loss, which can be irreversible. And why does it matter in India? Because 100 million people are living with diabetes, out of which 16.9% diabetics who are 50 years and above have diabetic retinopathy. 3.6 percentage out of this number usually have sight threatening diabetic retinopathy, and 4 million are at a risk of vision loss. And why is it silent? Because, like I just mentioned, in the early stages, there can be absolutely no symptoms. Only when a patient just goes for a normal eye checkup, only then can the diabetes retinopathy can be detected. So, to understand what are the stages of diabetic retinopathy, I can explain in very basic terms. Firstly, the first image that you see here is a normal retina. In the next image, you see the first stage is called the mild non-proliferative diabetic retinopathy. In this, in the blood vessels of the retina, there can be very little swelling. because of which there can be no symptoms. But once the retina is seen by a doctor, the doctor can tell you that, okay, you have stage 1 of diabetic retinopathy, and now you strictly need to keep your sugar under control. The next stage that it goes into is moderate NPDR, that is moderate non-proliferative diabetic retinopathy. In this stage, there are more vessels that are involved, more vessels get swollen, and there can also be some swelling on the retina, which can ultimately lead to something called macular edema, which can reduce the vision in the eye of a patient. Now, the next stage that it goes into is severe non-proliferative diabetic retinopathy. What happens here is a lot of vessels get blocked because of diabetes, and the retina starts lacking oxygen, because of which it wants to make a lot of new vessels as a response to this. And then it ultimately leads to the final stage, which is called the proliferative diabetic retinopathy. This stage is actually very sight threatening, and it can also lead to something called as vitreous hemorrhage, which is bleeding inside the eye, something called as retinal detachment, which can ultimately lead to loss of vision. Now, what are the symptoms? Firstly, patients can have blurry or cloudy vision. There can be floaters like complaint, which basically means you may feel like something is something like a hair or like a mosquito is floating in front of the eyes. And thirdly, there can be sudden vision loss in the eye. All of these symptoms occur in later stages, not in the initial stages. If the diabetic retinopathy is untreated, there can be vitreous hemorrhage, like we just discussed, which is bleeding inside the eye. There can be detachment of the retina, which can ultimately lead to blindness. That is why diabetic retinopathy is one of the leading causes of blindness in India. Now, how can we prevent diabetic retinopathy from happening to us? It's like everything is in our hands. We need to strictly control our diabetes. We need to be very strict with our diet. We need to not miss our medicines, go for regular walks. If there are habits like smoking or alcohol in the lifestyle, that should be cut down. A lot of healthy food should be consumed, like green leafy vegetables. And if someone has diabetes, there should be no sugar or jaggery in the diet. All these diseases, and to control these diseases, everything is in our hand. And an annual eye checkup is a must for everybody, with or without diabetes. But if someone has diabetes or hypertension or even high cholesterol, it is absolutely necessary to get an eye checkup done every once in a year. What happens then is sometimes you may feel that I am regular with my medicines. My vision is okay. Why do I need to go see a doctor? Sometimes, if we catch the diabetic eye disease in an early stage, we can just give you a warning sign that, now you need to maybe see your physician again. Now you need to change your diabetic medicines because diabetes has started showing some symptoms in the eyes, and you need to be more regular with your exercises. So that's why we always advise to all our patients for an annual eye checkup. Apart from diabetic retinopathy, also sometimes glaucoma can also be a silent disease in the eye. That also we can catch only after a dilated evaluation. Now, what are the treatment options for diabetic retinopathy? In case a patient has a swelling in the retina, for that swelling, an injection can be given to reduce the swelling. Injection is given absolutely inside the eye, so it acts faster on the retina and the swelling goes away. If a patient comes to us with a diabetic disease in a very severe stage, then we do something called laser therapy. In that, what we do is we give tiny burns on the retina with just a laser beam so that no more new vessels are formed in the retina and there can be no further bleeding in future. And ultimately, if someone comes to us with sudden vision loss, which means the patient either has a vitreous hemorrhage in the eyes or has come to us with a retinal detachment, in such cases, then we need to advise for a surgery. Lastly, I would just like to say diabetes can silently damage your eyes, and a yearly eye checkup can save your sight. Thank you so much. I I can also take any questions that anyone can have, and we can actually have some discussion.
Ma'am, you can continue. So if they have any question, they will put it in the chat box and I will raise it up in the end of the session. Okay?
Okay, not verbal, is it? I'll put it on chat box then.
Hello.
Hello, am I audible?
Yes,
Yes.
you are audible. What care I should take for dry eyes?
For dry eyes, sir, firstly, you need to reduce your screen time if at all the screen time is high. Like when we are looking at the phone or when we are looking at a laptop or something, we forget to blink sometimes. That is what causes dry eyes. Sometimes, because of some infection on the eyelids, there can be dry eyes. So, lid hygiene is very important, that should be maintained. If someone has dandruff in the hair, that can also transfer to the eyelashes. We call it blepharitis. So that should also be taken care of. So all these are just small, tiny, daily things that we can just do to prevent dry eyes from happening, which is lid hygiene, lesser screen time. If you are looking at the screen, make sure you take a break every few minutes. If you take a break every 20 to 30 minutes, your eye will be well, like it'll have regular tear supplements in the eyes and you won't have any dryness. If the dryness is very severe, you can visit an ophthalmologist near to you and they can just give you an artificial tear supplement for it.
Doctor, the chat box has been disabled. So only verbally we can ask. If it is
No.
enabled, we can type our this one, questions.
Okay, okay.
Ma'am,
Yes, yes, please, sir.
hair coloring, is there any effect on the eyes?
No, sir, you can go for hair colors. Just make sure that it doesn't go in your eyes when you're washing it, because ultimately it's chemical. So you don't want chemical going into your eye. So whenever you're washing away your hair color, make sure your eyes are shut and maybe your head is tilted at a like at an angle so that the hair color goes away from the backside and it doesn't enter your eye.
Even sometimes we used to apply this color on our eye, the thing, hair is there, no? So is there any effect for even applying
On the eyebrow hair, sir.
yes, eyebrows?
That should be avoided, sir, because that's very close to the eyes. So it can also cause a chemical injury in the eye if at all is it goes inside. So hair color is okay, but eyebrow color should be avoided if it can be.
Oh, thank you.
Ma'am,
Yes,
When I look at screen or a book, after
yes.
a few minutes I get, watery eyes. What
Okay.
exactly is the reason and how to, avoid, prevent this watery eyes after a few minutes?
Sir, watery eyes can be because of dryness in the eyes. That's what happens when we are looking at the screen for too long. We forget to blink. Our blink rate becomes like we are so focused on the screen that we actually forget to blink. That's why you take a break every 20 minutes, sir. You take a break, you maybe have a glass of water, go for a walk, come back, and then you start watching your screen again. If it's still watering too much, like we actually call this 20-20-20 rule, to take a break every 20 minutes for 20 seconds and to just look somewhere far, maybe at a distance of 20 feet. So this will be very easy to remember, 20-20-20. If the watering still persists, then maybe you can just see a doctor and get a very safe tear supplement. And
Yeah.
tear supplements can be used on a daily basis.
Yeah.
It's has no side effects at all.
I would like to add another thing also.
Yes.
Overnight, next morning when I get up, my eyeglasses are, white, residue type of, substance, and then I got to clean it every morning. So what
Yes.
is that? What exactly is the reason for this, doctor?
So normally discharge can be there because our eyelids have a lot of small glands which are responsible for tear production to keep our eyes moist and to not make our eyes dry. When we are sleeping, our eyes are shut. So it's very normal for all those lipids and all those tears to get accumulated at the corner. But
Okay.
in case it's associated with redness or maybe sticky discharge, mucoid greenish discharge, then it can be because of an infection in the eye. Otherwise, little whitish discharge in the morning is normal, sir. Nothing to worry about.
Thank you.
Ma'am,
Thank you.
Yes, yes, sir.
ma'am,
Yes, sir.
ma'am,
Please tell
uh,
me, sir.
for a diabetic,
Yes,
apart from yearly checkup,
yes, sir.
uh, can you suggest any, or is there any eye drops which can be used without any medication, but without any prescription to keep it
No,
healthy? Or
sir. For diabetic retinopathy, like there is no medicine as such, so that it can just control your disease from progressing. What you can do is every 3 months, you keep getting your sugar checked. There is this test called HbA1c. It basically tests the glucose level in the blood.
yes, yes, that we are doing.
Yes, yes, that is very important, sir. And fasting and post meal sugars are also important. Exercises are extremely important, but there is no medicine as such which can just, prevent from the disease to progressing.
No, for normal care of the eye, any eye
Normal,
drop.
yes, yes, and for a normal care so that dryness cannot happen, any artificial tear supplement is okay. But one thing I would want to request is over-the-counter medication should be avoided, like self-medication should be avoided. Very commonly, we have noticed that pharmacists just very easily give away this eye drop called Ciplox D, which is actually a steroid and it should not be used without a prescription. So that everyone should be careful about. Otherwise, any tear supplement is safe. One thing that should be taken care of is after opening an eye drop, you should discard it after a month, because after a month it becomes expired and it can just cause an unnecessary infection in the eye. Otherwise, you can continue using it.
Thank you, ma'am.
64 years old, doctor advised for cataract operation.
Yes.
This doctor advised to check eyes for every 3 months.
Hmm.
So, what is your advice?
Sir, cataract, like whatever your vision may be, cataract can still hamper a lot of it. Like you may be seeing perfectly fine, but there can still be some cataract. These days, what happens is we don't wait for the cataract to be 100% mature, because the more mature the cataract becomes, the more difficult it gets to operate it, and the chances of complications also increases. So if there is a significant amount of cataract, like say there is a cataract of around 40 to 50%, then it's absolutely advisable. You can absolutely go for it.
Doctor, I got a couple of questions.
Yes, yes, sir.
Today's subject is diabetic retinopathy.
Yes, yes, sir.
But does a non-diabetic person get affected by retina, retina.
In the retina. Yes,
Yes.
sir. Sometimes it can also be so that a patient does not have any diabetes. They can just go for a normal checkup and we can see diabetic changes on the retina. Apart from diabetic changes, there can also be some weak areas on the retina which may need some treatment. There can also be some changes related to glaucoma on the optic nerve. That is why, if you just get an annual checkup, all these things can be taken care of. Not just for diabetic retinopathy, for optic nerve, for the overall health of the retina, for dry
Okay.
eyes, for age related macular degeneration, all of this can be taken care of.
Okay.
Yes.
And can you differentiate the symptom of vision
Yes,
between
sir.
retina and cataract?
So in cataract, there can be a lot of cloudy vision.
Mm.
It like everything will seem uniformly blurry to you. At night
Okay.
time, when you will be driving a car or driving a bike, there'll be a lot of glare. Whenever you look at any light, there'll be a lot of glare around it. And in diabetes, the in cases of bleeding in the retina and in cases of retinal detachment, where the retina just leaves its place, there can be something like curtain falling in front of the eye, or they,
Okay.
or suddenly there can be a lot of floaters in front of the eye, like hair like substances or mosquito like things floating in front of the eye. So that is how you can differentiate, and you can just immediately go and see a doctor.
This floaters, what you said, will it be permanent or occasional?
Sometimes one or two floater is okay, sir. Everyone sees it. What is a floater in normal cases? Basically, eye is like a ball. Now,
Yes.
now to keep the ball in its original shape, there is a jelly filled inside called vitreous jelly.
Yes.
Normally, also, there can be some hair-like thing, one or two strand in front of the eye. That is normal. That's just that jelly
Okay.
that is floating. But if suddenly, if a patient starts seeing something around more than maybe 10 floaters, then that is
Okay.
a concern. And that is an emergency. You need to go see a doctor immediately.
Okay, doctor.
Yes,
And
sir.
this checkups you said,
Yes.
approximately what will be the cost of the checkups? And
Uh,
what type of checkup is it?
Sir,
Because
it,
for other parts, they
yes.
take X-ray or screening. Whereas for the eyes, what is the type of checkup?
So if wherever you go to any eye hospital, they'll firstly check your visual acuity, like how you can see with and without glasses. And then they'll give you the best possible glass correction. If
Okay.
at all your vision is not perfect with a glass, they'll send you to a doctor because there can be a cataract. If there is a cataract, the doctor will then ask you to get dilated. What we do in dilation is we just put one eye drop so that the pupil, normally the pupil size is very small. It's around 1 to 2 millimeters. But
Yes.
with that small size of pupil, we cannot see how much cataract is behind the pupil and how the retina is behind the cataract. So only
Okay.
to see all of that, your eyes will get dilated. Once your eye is dilated, the doctor can tell you if you have any cataract, if your retina is healthy, if any treatment is to be taken or not for it. So these are the basic tests.
So it is through diluter, not
Dilated test.
scanning or
Yes.
X-rays.
So after seeing the health of your retina, the doctor can take a call that if any scan is to be done, if any sonography is to be done. So that depends on how the health of the eye is. Not
Okay.
everyone needs it.
That is what I wanted to know. But
Yes.
primarily, will it be scanned or
Yes.
it is at the last stage?
Yes, yes, sir.
Scanning.
That the doctor will decide.
Yeah,
Otherwise,
that is what.
yes,
Okay.
otherwise only dilation is the main test to be
Hmm.
done every year. Yes, sir, please tell me.
What will be approximate cost, doctor? Any idea?
Sir, it depends on
Yeah, definitely.
yes,
Definitely.
it
That is why
depends.
I'm asking approximate.
Yes. So sometimes in most of the hospitals, it's included in the consultation charges, sir. For dilation, Not many people charge anything separately. But if
Okay.
anyone is advising for a scan or a sonography, then you will have to pay some different charges. That's all.
Okay, doctor. Thank you.
No problem, sir. Yes, sir, please tell me.
Hello,
So
doctor.
you,
Yeah, good evening.
good
Yeah,
evening, sir.
Doctor, I'm a retired.
Okay, sir. Sir, you're mute, sir. I can't hear you. Yes,
Yeah, good,
yes. So you're mute again.
yeah,
Some
Again,
uh,
again
yeah.
you went on mute, sir. Just keep your mobile a little away from your hand.
now I can hear you, sir.
Yeah. So I'm a retired army officer, 61
Yes,
years old,
yes,
and
sir.
I have a family history of glaucoma. My father, again a retired major, he had a total eye loss in one eye due to glaucoma. Okay.
Okay,
Then later, the other eye also caught with glaucoma, and he lost almost, 80-90% of vision. Okay.
oh,
So now my sisters, the elder sisters, three of them, they have traces of glaucoma. But
yes,
I am checking my eyes regularly. Like you said, annual eye checkup, I go for that. And so far, so good.
yes, sir.
So my question is, this glaucoma, can it be prevented by any sort of food or any sort of eye exercise, something? Can it be prevented or
Uh,
delayed?
no, sir. So glaucoma, like to control glaucoma, there is no food or any exercises as such.
Okay.
But we can just catch early signs of it. That's why maybe whoever your doctor is, they have been seeing you in regular intervals. Even in early stages, if we catch glaucoma, we can just start the patient on an eye drop and we can stop it from progressing any further. But
Okay.
for it to not happen at all, there is no medication as such. Early signs we can catch and then we can treat you accordingly.
And I'm sorry, I joined a bit late. I'm sorry for that. And
Yes.
I couldn't get that impact of floaters, which you said, because when I was a child, I used to get a lot of that floaters. I used to play with that.
Yes.
And but now it is stopped.
Yeah.
No more floaters. But what is the negative side of seeing a floater, or how
So,
to
so
cure?
floaters can happen in a few situations. Firstly, now, like today, we discussed diabetic retinopathy. In patients with diabetic retinopathy, there can be some bleeding in the eyes. They can have some floaters. Apart from this, if someone has gotten hurt in the eye with a ball or they've fallen and suddenly they are seeing a lot of floaters in front of the eyes, that can be because of some weak area on the retina. That can also be because the retina has left its original place. So these are just signs that your eye is giving you that this is not normal. Like one or two floater is okay, but seeing so many floaters suddenly, you need to go see a doctor. So it can happen in all these conditions, sir.
Is there a corrective surgery for that presbyopia, doctor?
For presbyopia, sir, there is something called presbyon LASIK these days. But after, like, if anyone gets a presbyon LASIK, they will develop a cataract later. So they are going to get a number because of cataract anyway. So the better option, if you ask me, would be to go for a cataract surgery, because in cataract surgery we have such an advancement that we also have an option of going absolutely glassless with a multifocal intraocular lens. So multifocal,
IOL.
yes, multifocal IOL takes care of all the distances. So the presbyopia also goes away if you go for a multifocal lens. So that
But cataract, I can look forward when I develop the symptoms,
when you
no?
develop it. Yes, yes, sir.
Yeah. Thank you, doctor. Thank you.
No, no problem.
Ma'am, recently I got tested for this retinography.
Yes, yes, sir.
In that they have mentioned a drusen present and
Yes.
vitreous haze present. What exactly do you mean by that?
So drusen is basically they are cholesterol deposits on your retina. So drusen, if someone has, we call it something called age-related macular degeneration. But if there are only little drusen, that too not in the central part of the retina, we are not worried about it. Because in the peripheral retina, your vision will not be hampered because of it. But if it's involving the central part, that's when your vision will be hampered, and the doctor can ask you to go for a scan for it.
And what about that vitreous is that also is present, it is stated,
Uh,
reported.
no, sir. So that jelly that I was telling you about, that is called vitreous jelly. In some people, it is more turbid than other people, but it's normal. As long as you don't have any infection in the eye and the doctor feels that you don't need any treatment for the vitreous haze, you need not worry about it.
And you, as you said, that drusen, if you said if we are found it in the center of that retina, how can we make out?
That the doctor can make out, sir. If the doctor has not advised you for a scan, then there's a possibility it's not involving the central retina. Sometimes drusen are very commonly found in the periphery of the retina, which is okay. We can avoid it.
But the doctor will prescribe any medicine for that?
Yes, there are, like, we can give a course of antioxidant medicines, but that too, like, the doctor needs to take a call if you actually need it, or if there are only few drusen, then we can just avoid it.
You mean to say it's a deposit of cholesterol?
Yes, sir.
Nothing to worry about that.
Nothing to worry about, sir. You just keep seeing your doctor every year.
Okay,
That's
thank you.
all.
Dr. Pratibha, good evening.
Good evening,
Good
doctor.
evening.
Good evening. I am PS Murthy, Dr. Pratibha.
Yes, sir.
I am PS Murthy. Can I speak, doctor?
Please tell me, sir.
Yeah. Doctor,
You are
Sir,
muted.
you're on mute. Can you
You are
please
mute, sir.
unmute yourself
Hello.
and
Hello.
Yes.
Yeah, Dr. Pratibha. Good
Yes, sir.
evening. I am
Good evening.
PS Murthy. I am a
Yes.
retired government servant. I have
Sir, I
Sir, you
cannot.
are going on mute every now and
yeah.
then.
Okay. Good evening. Am I audible now?
Yes, sir. You
Yeah.
can.
No, Dr.
Yes, you can
Pratibha.
get your question, sir.
Yeah, my question is that I had my cataract operation for both eyes done in 2012,
Yes.
both together in a month's gap. Now we are in 2025. So 12 years have passed almost. So is there any, I'm a diabetic.
Yes,
So is there any chance of reoccurring cataract again?
No, sir. Cataract once taken out cannot reoccur again, but
Okay,
there is something called posterior capsular opacification, which can
okay.
happen behind your lens. So suppose this is your lens that has
Uh,
been after taking out the cataract. There
uh.
can be a very thin layer that can deposit here behind the lens, and that can make your vision to be a little blurry. And for that, if your vision is significantly less, the doctor will advise you for a very small laser procedure, which we just do it in the OPD itself.
Is that what cholesterol you are talking about just now?
No, sir. This,
Uh,
this thing is not on the retina. This is just behind the lens that has been put. That cholesterol thing is on the retina at the back.
oh.
Yes.
So this is between the retina and the lens, which
Yes.
was fixed at the time of cataract operation.
Yes.
So
And
maybe
that too, not everyone develops it, sir. Some people
okay.
develop it and some people do not develop it.
Is it due to diabetic? No.
No, sir. It's not because of diabetes.
Okay. Good. Thanks a lot. God bless you. Thank you.
Thank you,
So
sir.
Hello,
Sir,
doctor.
Good evening,
yes.
doctor. This is Jambunathan. Can I speak, doctor?
Yes, sir. Please,
a
please.
quick announcement. I'm sorry, doctor.
Yes.
There is a poll appearing on the screen. I kindly request all our members to please take the poll.
Sure, ma. Sure.
I request all our members who are attending the webinar to please take the poll.
Can you just put the poll once again, madam? Ashwini, madam.
Yes, sir, it is appearing on the screen, sir.
No, unfortunately, it is not there in my screen, ma'am.
Jeet, can you please, launch the poll again?
No, it is visible on the screen, madam. I'm actually responding to it.
Okay.
Can I raise a question, ma'am?
Yes, sir.
Yes, sir, please go ahead, sir.
Please
Good
ask.
evening.
Good
See,
evening.
I'm not I'm Jambanathan. I'm 77 years old. I'm not diabetic.
Yes, sir.
But what happens, often I get the water in my eyes.
Okay, okay.
So there is, stagnation of water. And
Hmm.
it gets, when I wipe it, it just goes off. What is it due to? Can you just suggest any treatment for that?
So, I would suggest you to see a doctor because watering can be because of a lot of reasons. It can be because of an allergy, it can be because of an infection, it can also be because your tear duct passage is blocked over here. We have a nasolacrimal passage over here. So, it can be blocked, which can lead to watering later. So, you just see a doctor once because you will have to be examined on a machine to be prescribed a treatment.
Is it something, does it need some surgery or something like that? Or
No, sir, it can also be taken care of with a drop. That's why I just see a doctor,
in
sir.
fact, so far I have not done any cataract or anything like that. My vision is normal. And with the glasses, I'm able to read absolutely no problem. Only
Yes.
problem, this is again applied. This is maybe for the last 6 months or so.
Okay.
Lot of water stagnation, that's all. But
Okay.
anyway, it just goes away after some time.
Okay,
So
sir.
anyway, as I suggested by you, I will see a doctor.
Yes,
Right?
yes, yes. Thank you, sir.
Good evening, madam.
Good evening. Good evening, sir.
This is Srinivas here. Regarding that HbA1c, madam, it should be maintained at what level to ensure that retinopathy doesn't happen for
So,
diabetes?
so in non-diabetic patients, it should be below 5.6. People
For
who
diabetes,
for diabetic patients, it depends on how your other parameters are. Like what I would say is a good level is if you are maintaining it below 6.9, then we are okay. Like till 6.5 is a very good level for diabetic patients. In my opinion, it should not go beyond 7. Because if beyond 7 for a long time, then there is a very high chance that you will develop retinopathy in future.
Okay, thank you.
Okay.
Hello. Good evening, doctor.
Good evening, ma'am. Please tell me.
I'm a diabetic. I
Yes.
get this very occasional type of floaters. Can it be reduced by eye exercises?
No, ma'am. So floaters cannot, like most of the things cannot go away with just exercises. Sometimes with floaters, what happens is if it's just one or two, we get used to seeing it. Our brain is such a thing that it just accepts it and it just starts ignoring it. But if you're seeing floaters on a regular basis every day, every time of the day, then you should go see a doctor. But if one or two, then that's okay. That's not a problem.
Okay.
Man,
Thank you.
people are talking about this eye exercise. What exactly is it? How to do it? What exactly is it? I didn't understand that. Eye exercise.
So eye exercises basically don't take care of diabetic retinopathy, glaucoma, cataract. People think like it's a misconception that only by doing exercises, cataract will go away, glaucoma will go away. That does not happen. We advise for exercises in children who have maybe some squint, or like squinting is basically deviation of the eyeball. In those cases, we advise for exercises. Otherwise, eye exercises don't help with all these eye diseases.
And what exactly is it? How to do that? What exactly is that eye exercises?
So we don't advise for it.
Thank you very much for your session. I
No.
wanted to ask you about my son who's 33, he had bleeding in the eyes.
Ma'am, I can't hear you.
Sorry. When we went to the doctor, retina specialist,
Yes.
she said that he has macular edema and asked for the tests for cholesterol, diabetes, and BP. All the results came as normal. What could be the cause of this bleeding and macular edema?
Macular edema.
Yes.
So, ma'am, there can be a lot of causes. It can be because of blood pressure. What happens in blood pressure is any vessel can get blocked and it can ultimately result in a swelling on the retina. It can happen because of diabetes. It can happen in something called CNBM, which is also a degenerative condition of the macula. So there are various causes, ma'am. It can also happen in cases where a person is smoking too much, or a person has, like, he's undergoing a lot of stressful condition, he's having a lack of sleep. All these situations can also lead a swelling on the retina. So these are the reasons that can lead to a macular edema, ma'am.
Ma'am, is there anyone called retina specialist, as these people are always calling?
Yes, I am a retina specialist, sir.
No, eye specialist is the one who can take care of all these things. But retina specialist, is there anyone like that?
So retina specialists are basically who've done a super specialization in this branch. So I've done, after my post-graduation, I've done a fellowship in medical retina. So for those people, this term is used.
I want to ask you,
Yes.
if a diabetic person has done the cataract surgery and got implanted the lenses, is there still any chance of retinopathy?
Yes, ma'am. Cataract has no relation with the diabetic retinopathy, ma'am. They are absolutely different entities. So if
Cataract is not for the retina?
no, ma'am, cataract is not for the retina. Cataract is in the front portion of the eye. Retina, like if this is a ball, this is the cataract is happening, and this is where the retina is. Retina is the last layer of your eyeball. So cataract has no relation with diabetic retinopathy. But in diabetic patients, cataract can develop earlier than normal people.
That's okay. The cataract surgery is already done.
Yeah.
Okay, I got it. Thank you.
I will just want to thank you all for joining this session. I hope you found these tips useful. And I would just like to tell you, all of you, to take care of your eyes and get an annual checkup done and get your diabetes and BP under control. And thank you so much, Miss Ashwini and Mr. Robert, for hosting this session and letting me be a part of this.
So, Doctor, thank you very much for that insightful and informative session. Your guidance has shed light on the importance of early detection, timely intervention, and proper care in preventing vision loss from diabetic retinopathy. A
Thank you.
heartfelt thanks as well as to all our participants for joining us today. We hope this session has empowered you with knowledge and practical steps to protect your eye health.
Madam, can you
And before we sign off, a quick reminder, on 30th August, Vayah Vikas will be hosting a senior strollathon in Mysore. It's a joyful walking event for seniors aged 55 and above at the University Oval Grounds. The participation fee is 250 and you can register by calling 95133000821. I repeat the number, it's 95133000821. We would love to see you or your friends and family there. On behalf of Vayah Vikas, thank you once again for being with us. Stay healthy, stay safe, and take care of your eyes.